But right now, we want to go through all the different verbal operants and sort of what they mean, what they do, and why they play a role. So,
okay. So there's the listener behavior, which is the receptive that we talked about, and I think that's pretty straightforward. That's just when you give an instruction and then the child responds, right?
Okay.
And then beyond that is all of the other operants, which we were just talking about echoic. So echoic is where when the therapist says something, then the child repeats it. So repeats it exactly back. So the word echo is in there, so that is hopefully easy to remember what an echoic is. So I might say fish, and then the child says fish. Okay. Then we have the mand, which is when you, or when the child is actually engaging in verbal behavior to gain access to something. So it specifies the reinforcer and the response. So it says, the child says fish, and then is actually requesting a fish. So to remember the word mand, think of command. So the child's making a command or a request in that instance. And then we have tact, which is where now let's say they're at an aquarium and they see a fish and they point and they say fish. This is a classic example of where we probably wouldn't see something like this from just doing the traditional teaching of only receptive and expressive as was done in the olden days.
Yeah.
And so the behavior there is under the control of the actual item of the fish being present. It's not under the control of anyone's questioning or anything like that. And the reinforcer is not to gain access to the fish. It's just social interaction, or in the case if we're teaching it through cards or something, it might be some other reinforcer like a tangible item.
Okay.
High fives, tickles, whatever's reinforcing for the child. And then we have an introverbal, and this is where they're responding now to someone else's verbal stimulus. So if I say, name something that has gills or something like that, and the child says a fish, then in that sense that they're responding to my vocal stimulus with a vocal response.
And the fish, for a true interverbal, usually whatever the thing is that they're responding with, it's not there, it's not present, right? They have to be able to pull it up without a visual there.
Yes. So that's the other thing, is that some of these verbal operants can either be considered pure or impure. So when they're pure, then they're not under the control of some other variable. When they're impure, then they might be under the control. So like if I said name something with gills, and I had a picture with a bunch of options, and some of them were wrong and some of them were right, then that would be considered also partially under the control of a tact, because they have that item there.
Okay.
Because with the tact, what they're responding to is the nonverbal stimulus.
Okay.
Not the verbal. So, and a lot of times we do that as ways to teach. So when we're trying to get to the interverbal phase, we don't just necessarily go straight into, there's nothing to do with fish around, and I say, name something that has gills. I would instead probably start with some sort of what we might call a tact introverbal, and have items to choose from, and then once they're pretty good with that, then I would fade that out and then go to the pure interverbal.
Okay. And at that point, I think if parents are out there and going, okay, I'm a little bit confused, I would say to you, it's okay.
Yeah.
It's okay to be a little bit confused, because it gets to very fine work of understanding how language is built, and the therapists and the BCBAs are very good at that. And I don't know that it's necessarily imperative that the parent really understand the difference between a pure and an impure tact, and under the control of a tact. Ooh, who cares? But we all care about, can my child utilize language in this way? And do I have the ability to create and be a part of a program for my child so that we can work towards that? And I think the answer to that is a resounding yes.
So what I would suggest as a parent, of what your take-home point from this conversation would be, is, in my child's ABA program, are they trying to address all these functions of the language, or are they doing the olden days receptive and name the item for expressive, which is kind of a tact, basically? But it's also even under the control of the vocal instruction of the therapist, because they hold up something and go, what is it? And that's not truly a tact. A tact is when you're in the environment, you see something cool and you go, oh, look at the clown, or whatever. Yes. It's supposed to be under the control of the object, not the vocal instruction. So that's even worse if all they're doing is, what is it? What is it? And there's never a time where the child's spontaneous.
Yeah, if your child doesn't make that leap.
If you see that in your ABA program, then you know that you should talk to your clinical supervisor about using more of a verbal behavior approach, or and teaching all the different operants. And just remember that for your purposes, you're concerned with, can they repeat? So That's the echoic. Can they request? That's the mand. Can they label things in their environment without instruction? That's the tact. And can they engage in conversation about things? That's the introverbal.